Hello, I'm Tony Shaw.
Hello, I'm Diane Stevens.
We're physical therapists from the University of Vermont Medical Center Pulmonary Rehab program. Today, we're going to talk about intimacy in the context of chronic pulmonary disease. And yes, that means we'll also be talking about sex. So send the kids and the grandkids outside to play or plug in your headphones so they'll have no idea what we're talking about, and then we'll begin.
To put you in the mood, we want to kick off this topic by sharing with you a 9-minute video we discovered on YouTube on the subject. Michael Reiser, the presenter, an Ohio Buckeyes fan from Garland, Texas, passed away in 2018, but his friends and family remain proud of his determination to help people like himself with COPD and with other types of chronic lung illness to live fulfilled, happy lives.
Overall management of our COPD. Now, some of you may have noticed that your sex life may have decreased. The top two being one, your fear of becoming short of breath may curb your desires, or two, certain types of medications will most certainly reduce your sex drive. Now, keep in mind that none of the medicines that you take for your COPD should cause a decline in your sex drive. Although if you suspect that one of your medications could be causing a problem, speak with your doctor about exploring the use of possible alternative medications that will work best for you. Now, another major cause is that our partner often feels that they should back off because they think they would be doing us more harm than good. But as you'll see, for most of us, it's just the opposite. It's more beneficial than harmful. Another catalyst for the decrease in our sex life could be the depression that's so often seen in COPD patients. And last but certainly not least is that as we grow older, we do tend to slow down a little more naturally. Now, the definitions for intimacy are many, but some consider intimacy as a physical closeness, and to a much lesser degree, it is. But it's so much more. It's the bearing of secrets of the mind, body, and the soul to another individual, which does often culminate in the act of making love. It's presenting your complete self in a vulnerable state to others for a greater reward, that being love and affection. It's the intimacy that rewards us, the familiarity, the warmth, the affection, and the closeness that come with family and close friends. In short, intimacy could be considered as the root to our basic emotional comfort. It shelters us from the negative events we face daily. It allows us a safe place to lie down to heal and process the daily confusions in our lives. We can relax and just be ourselves. With COPD, any form of relaxation is good, but this is one of the best. And through intimacy, you can find the emotional support that you need to get through many of life's trying times, including those presented by COPD. Now, in order for you to have a successful and healthy sex life with your partner, or if you're single, your potential partners, you need to be direct and open about what you and your partner want to expect out of sex. For some, initiating this conversation can be difficult. If this is the case, try an intimate phone conversation, or perhaps writing a letter. Anything, just get the conversation started in the right direction. Now, whether your sexual desire is the product of fueling the fires of passion and intimacy or dousing the flames of raging hormones, the physical act of sexual intercourse can be considered simply as a form of exercise. It works a certain muscle groups, it raises your heart rate, it increases respiration rate, and it burns calories. Now, as we've learned so far, we know that exercise is good for the mind, body, and soul. It tones our muscles so we can use our oxygen more efficiently. It increases our metabolism so we can burn calories more effectively. It increases our endurance levels, aids our immune system, and it helps reduce depression, and the list goes on and on. So if your doctor says you can exercise and you can climb one flight of stairs at a normal pace or do a brisk half-mile walk, there is absolutely no reason, as far as your COPD is concerned, that you shouldn't be able to live a healthy, satisfying sex life. Now, some of you may not be able to climb the stairs at a normal pace or even do a brisk half-mile walk, but still be able to be sexual and intimate. Now, here it becomes a matter of testing the waters, so to speak. So my advice to you would be to start off slowly and learn your limitations. Understand that because of your COPD, certain sexual positions may no longer be an option to you. So be prepared to experiment by trying alternative positions that work for both you and your partner. Now, some of the little tips you might want to consider is, one would be to get fit. You need to start an exercise program to get into shape to enjoy a healthy sex life. Maybe walking and gentle exercises to start, or preferably a pulmonary rehabilitation program would be the ideal situation. Plan the right time. Those of us with COPD are most energetic during certain times of the day. So the problem is that we're all different as to when those times are. And one good idea is to plan for when your long-acting medication would be working at its peak. That would be to help you reduce any shortness of breath that you might encounter. And another way to help reduce your shortness of breath even more is your quick recovery inhaler. Take that medicine 15 minutes prior to having sex. And that should help benefit you greatly. Understand that shortness of breath during sex is a normal thing, and even for healthy people. But it should not cause you dangerous respiratory rate levels. And if at any time you feel the need to stop and rest, then do so. Keep in mind that doesn't mean you must stop everything. There's no reason why you can't continue to caress and touch one another while resting. And number 4 tip here would be use a fan. A cool, gentle breeze over the face will help move any pockets of air that you've exhaled away from you so your breathing does not become distressed. And last but not least, avoid alcohol and heavy meals. You want to wait at least 2 to 3 hours after a heavy meal before having sex. Digestion requires a considerable amount of oxygen and will cause you to become short of breath sooner. Not to mention that when you've eaten a heavy meal, all that food is lying down there and it's actually putting pressure on your diaphragm so it won't move as far and you won't be able to take in the breaths as efficiently as you need to do. So try to keep that part in mind too. Now, for those of you who are on oxygen, check with your doctor about the possibility of increasing your oxygen flow during periods of physical exertion. Now remember, your goal is not necessarily to have an orgasm, but to have the most intimate possible time possible. Sometimes you'll have an orgasm, sometimes not. But through all we endure, just trying to cope with our COPD, our need and desire for love and sex and intimacy still linger within us. Perhaps love actually does conquer all. I'll see you next time on Living with COPD. Until then, breathe well, good people. Breathe well. For more information about sex and intimacy, go to these fine websites.
Michael's presentation is heartfelt and I think uplifting. We especially appreciate his emphasis on intimacy and not exclusively on sexual performance or intercourse. Intimacy can take many forms: holding hands, a hug, a peck on the cheek, an amorous kiss, a caress, bearing your feelings and emotions in words or actions, and it can be expressed in the heat of sexual encounter as all. It's all good.
Along with all of Michael's practical tips for sex with lung disease, he makes a point of emphasizing the importance of communication between you and your partner and any future partners. What worked for you between the sheets when you were younger or before your diagnosis may require some adjustment. In Michael's words, start slow and learn your limitations. With that in mind, finding ways to be upfront with your partner or partners so that each of you know what you can do to keep it safe and fulfilling for everyone is going to be extremely important. In a moment, Diane will share some additional practical tips. First, though, I want to talk a little bit about position. There is no one-size-fits-all advice for position, but if you have a copy of the Pulmonary Rehab Resource Manual, in Chapter 12, you will see several couples depicted in a passionate embrace, so to speak. In general, using less strenuous positions for sexual intercourse can help limit the shortness of breath that you may feel with sexual activity. And if you end up lying on your back during intercourse, make sure to use your pursed lip breathing and make sure your partner isn't putting any pressure on your chest. Alternatively, you may actually find that you breathe more easily in an upright position during sex, where gravity helps to move your belly out of the way and allows your diaphragm and your lungs to expand more freely. The long story short, don't be afraid to be creative, to give various novel positions a try and see what works best for you.
The resource manual, Chapter 12, contains a lot of additional information on intimacy and sex with lung disease. And we will put those links up on the screen at the end of this presentation. Before we go, I want to share some additional insights and some practical tips on the subject to help you enjoy physical intimacy as well as sex. As stated, Michael stated earlier, have sex when you feel rested and your breathing is normally best. This might be when your medication is most effective and your energy level is higher. This may mean some planning ahead of time, but remain flexible with that plan. If you happen to be stressed or tired, having sex can increase these feelings, making breathing more difficult. Be comfortable and relaxed. If you are cold or too hot, you will not be relaxed. Use a fan during lovemaking can be helpful, as Michael stated earlier. Try performing breathing and relaxation techniques before and after lovemaking, as you would with any physical activity. If you produce mucus, clear your bronchial secretions prior to engaging in sexual activity, or avoid having sex in the morning when you will probably be producing more phlegm. The other thing we talked about is avoiding sexual activity after a heavy meal or alcohol. A heavy meal not only requires more oxygen to digest the food, but it also makes you feel bloated, and it prevents the diaphragm from fully contracting, making breathing more difficult. Alcohol can decrease your sexual function as it is a depressant. However, a small drink, if it is allowed under your medical regime, may help you relax. Using your bronchodilator about 15 minutes or so before having sex may relieve your shortness of breath or wheezing by opening up the airways. This is especially true if you find your inhaler helps you during exercise. If you use supplemental oxygen for exercise, then utilize supplemental oxygen during sex. Remember, sex is exercise. And if you need oxygen during sex, you also need it during exercise. And if you need oxygen during exercise, you also need it during sex. What do you do if you become short of breath during intercourse? Hopefully, you've discussed this with your partner, so if this happens, you both remain calm. Try pausing or taking some slow, deep breaths from your diaphragm, or doing some pursed lip breathing. This will help you regain your breath and enable you to resume intimacy, rather than stopping altogether. The other thing you want to do is avoid irritants in the environment. Allergy-producing items in the environment, for example, perfumes and hairsprays, scented lotions and candles, can irritate your lungs and make breathing difficult. If you want to create a mood, battery-operated candles have come a long way and can create the mood lighting without causing a coughing spell, wheezing, or shortness of breath.
Those reasons.
With patience and good communication and a little planning, you can continue to participate in sexual activity, enhancing the loving relationship you have with your partner.